Afternoon. I'm Sarah Mendelson, head of the Carnegie Mellon's Heinz College in Washington, D.C. This is our third in a series on lessons in leadership in times of crisis. We're joined today by Wade Warren. Wade has 29 years experience with the U.S. Agency for International Development. He spent 10 years on the Hill before that, and he's currently the Chief Strategy Officer for International Development at Deloitte Consulting. I want to give you just a little bit more overview of Wade's illustrious career. Wade was known to a lot of us for writing pithy, interesting emails every Friday afternoon when he was detailed from USAID to the State Department's F Bureau, which oversaw foreign assistance, and he would translate for us what was actually going on. It was hugely invaluable. He's had a range of experiences. He's worked in Africa, in missions in Botswana, in Zimbabwe, in the Bureau of Policy, Public Policy and Learning, PPL. What's the PP stand
Policy
for?
Planning and Learning.
Policy Planning and Learning. As well as serving as acting administrator of the entire agency and acting deputy administrator of the entire agency. So lots of leadership roles. We're here though today to focus in on his experience as a deputy assistant administrator in the Global Health Bureau in the period 2013 to 2016, but particularly 2014, 2015, when there was an outbreak of Ebola. Wade, set the scene for us. What were you doing before the crisis occurred?
Well, thanks, Sarah. First, let me say thank you to you and your team for organizing this series of lectures. I know Tony Pippa and Susan Reichley, and so I'm proud to be in their company. And thanks for organizing. I have spoken to Carnegie Mellon classes before, but never over Zoom. So I'm glad to be invited back. But this is a new experience. So I was the deputy head of USAID's Global Health Bureau, which you know probably is the largest bureau in the agency of the amount of money that it programs. And I had been there for about a year, having come from, as you mentioned, the detail at the State Department, where you and I know each other. So the USA Global Health Bureau is a busy place. I was just running, helping to manage the many programs that the bureau manages. And the Ebola crisis, unlike what Susan Reichley experienced with the Haiti earthquake, did not happen all in a single moment. So it grew over time, and I think we. In the agency, actually, because of our deep contacts in West Africa, were aware and worried about it before it became quite as prominent in the international news as it did, of course, eventually become. So I think they have subsequently realized that the first case was probably in December of 2013, but it came to our attention, I think, in January or February of 2014. And we were urging other agencies in the government to take it more seriously, and urging the World Health Organization more seriously as well. But by March, I guess, many people had realized the nature of the crisis, and so the agency formed a task force to deal with Ebola, and they asked me to lead that task force. So I took that on as a full-time job for quite a while there.
So in crises like this, there are many people who are the mothers and fathers of the response. Can you talk a little bit about, before we get to interagency, the intra-agency? As you know, I lived for 4 years in the Crisis Bureau. I think you know where I'm going with this question.
Absolutely.
The Office for Foreign Disaster Assistance is within DACA, and oftentimes they portray themselves as, well, they are the lead U.S. agency for foreign disaster assistance, but there's a huge role that regional bureaus play. There's a huge role that obviously the subject matter, in this case, health bureaus play. Can you talk about that experience a little bit?
Yeah, that's a great question, and I don't think there's any doubt about it that the Office of Foreign Disaster Assistance is the world's premier um, organization for responding to international disasters. So when there's an earthquake or a hurricane or a crisis of some sort, they are the premier responders. And I think at the beginning of the crisis, we didn't see it. It was originally seen more as a health issue than as a crisis that would require OFTA's response. But that did change over time, and eventually OFTA very much responded and in fact took the lead in the response eventually. But it was, I don't know if you are aware, if everyone who's listening is aware, but this was the first time that OFTA, the Foreign Disaster Assistance Office, had ever responded in the way that they normally respond to disasters, but because of a disease. And so a lot of the protocols and the ways that OFTA needed to work were developed on the fly as we went along. So it was very much a collaborative effort, I would say, between or among the Global Health Bureau for technical expertise around disease issues, for the foreign assistance or the disaster assistance folks for on the ground response, and then the Africa Bureau for subject matter expertise about the countries that we were dealing with. So it was a all hands on deck, cross agency, internal agency response.
But their point is well taken. A lot of times a disaster, in this case a health crisis, begins as a health crisis, and as we're seeing today with COVID-19, there's so many more complex layers. It's not just a health crisis. It's obviously, in our case, it's got huge economic implications, unprecedented ones. We're reading about food insecurity.
Right.
So there are these many layers of it, and it really helps us understand the way in which development and sustainability are so interconnected. It's not one silo versus another silo.
That's absolutely right, and I think that's why it was so important to bring in the Africa Bureau, for instance, in the response, because the folks in the Global Health Bureau obviously don't have the expertise in economics and governance issues, and even the humanitarian response folks. I think we all benefited from each other's expertise. I will say, and I know, I'm assuming we'll have a chance to talk a little bit about how the Ebola crisis and the COVID-19 crisis are the same and how they differ. But I don't think in the case of West Africa you saw as immediate economic implications, because there wasn't the kind of lockdown of the economy that we're seeing now, and countries everywhere are being affected by the lockdowns in other countries everywhere, which was not really a case in the Ebola crisis.
Right. We'll go back to the implications of what's going on today in a second. Tell me about some of the first impressions that you had as this is rolling through in 2014. Was it a sense of, I mean, Ebola was much more deadly.
It was, and those of you who remember, it's a very, very frightening disease, and I know people are scared now, and with good reason. But I think the thing that was so alarming about Ebola was the very, very high mortality rates. I think at the end of the day, they calculated that about 40% of people who became infected did die, which is a very high and scary mortality rate. So that really had everybody worried. I think the fortunate thing about Ebola is that it's far less transmissible than COVID-19 is. The real nightmare scenario, of course, would be a disease that's as transmissible as COVID and as fatal as Ebola. So hopefully we'll never experience anything like that. But to be honest with you, my first impressions were kind of ones of fear, because we really didn't know what to do. USAID had never responded to a crisis like this before, and eventually we came up with the idea of building Ebola treatment units and isolating patients and helping communities deal with the sickness. But at first we hadn't struck on that response, and so we knew we needed to do something. We knew we were going to need to coordinate with the interagency, particularly CDC, the Centers for Disease Control and Prevention, and also the Department of Defense. But we didn't know what we were doing, and I was just so aware. Each day we had a crisis room set up, and that's where I worked every day for weeks. And I would come there in the morning, and I was just so kind of struck by the fact that we didn't really know what to do, and we were trying things and making things up as we went along, which is kind of a scary place to be.
Doesn't sound dissimilar actually to where we are today.
Yeah.
These crises, we've been talking about it with our other guests about these are running a marathon at a sprinter's pace. It can take obviously a lot of physical and mental toll on people. Talk a little bit about how you handle that. You just mentioned you're in a crisis room for days on end, weeks on end, turned into months on end. What happened to you?
I don't have a great story to tell here. Or maybe it is a good story because it could be an object lesson for folks. But I have always been, and maybe I guess my wife would tell you, still am a bit of a workaholic. And I had no patience for people who grumbled, if they had to work long hours, and I thought I was fairly invincible. And so I was working, literally 15 to 18 hours a day. I would work until late in the evening and go home and go to bed and get up early the next morning and go back into work, Saturdays and Sundays included. So I worked, 15 to 18-hour days, 7 days a week for like 9 or 10 weeks. And I got so worn down that I myself got sick. I actually developed pneumonia. So people in the agency used to kid me that I was the only person that had gotten sick from Ebola without actually, getting Ebola. But I was quite ill actually, and I had to step down from the leadership position of the crisis response team. And it actually prompted us at that point to realize that we were going to have rotating leadership. So I stepped down, someone else stepped in. They served for about 10 weeks, and then they stepped down, and we rotated through that way. But it was an object lesson for me that you have to take care of yourself, and no matter what the nature of the crisis is, you've got to get enough sleep, you've got to eat right, or you won't be useful to your organization. And I've thought about that a lot, Sarah, with these people in the United States right now that are responding to COVID. And of course, I had nothing like the emotional trauma that they're experiencing in hospitals around the world. And I worry about them very much because they're not getting a break that they need. And my sense is they're not getting enough rest. They're not eating right, and they have this terrible emotional toll that they're having to deal with. So it's really we call them heroes, and they are heroes, but heroes have to sleep and eat and take care of themselves too, or they can't.
There's no question there needs to be some kind of public policy protocol in place. I mean, if you think about when you're on an airplane and if there's a crisis, God forbid, you've got to put your mask on first before you.
That's right. Before you take care of others. That's
exactly right. And so I'm hoping, and we'll get back to the building back better in a bit. Mm-hmm. I'm hoping that this will prompt a kind of call in public health policy that requires that you've got some kind of circumvention around these kinds of hours, because the toll is going to be enormous, and it's unprecedented. It's not fair, and it's not good policy. It's not good public health policy.
That's right. And these folks, who have chosen careers in healthcare are driven to help, and they will just work until they collapse if people don't intervene and make sure that they're taking care of them.
So let's turn now to some of the critical lessons that you took away from this emergency response situation. And we've gotten a couple common threads that others have brought up. I'll give you an opportunity to raise some thoughts of your own, but I'd be curious to the extent that the kinds of things that both Tony and Susan have brought up in previous sessions from Katrina, but also the Haiti earthquake, particularly the Haiti earthquake, because obviously it's the same agency that was responding.
Mm-hmm. Well, I think one big lesson learned for me was that the interagency, the relationships among U.S. government agencies need to be stronger, and protocols need to be worked out in advance for a crisis of this type. And as I said, the agency had never responded to a health crisis quite like this. And so not only did we have to work out the response on the fly, but we had to develop relationships with the interagency on the fly to make things work more smoothly. And interestingly, we already had good relationships with and protocols worked out with the Department of Defense, because the Department of Defense helps, as you know from your time in the agency, the Department of Defense helps with response oftentimes in food emergencies or fast-breaking emergencies like earthquakes and hurricanes. So we had protocols with the Department of Defense that worked pretty well. We did not have with CDC. And there was, I think, there was goodwill on both sides, and everyone obviously was struggling to figure out the right approaches and ways to work together. But there was no muscle memory from previous efforts, and we had to spend a fair amount of time working out swim lanes and how to move the money and how to work with one another. And I actually think that after, as you know, also from your time in the Bureau, that after a crisis, they always do a thorough evaluation to determine what went right, what went wrong. And one of the key findings was that USAID and CDC need standing protocols for working together, and those have been developed. And I think that's a really positive outcome from the Ebola crisis. So one, I think, big takeaway lesson for me was the importance of, to the extent possible, having already worked out arrangements within the interagency to respond.
Let's stay with this for 1 second, because there are a couple things to say. One, there are a lot of us thinking about what this would look like if you had sustainable development experts at a cabinet level. That if there's a completely different way of understanding both national security but also domestic policy that really elevates I think, Raj Shah was in some ways built for that crisis. He's built for this crisis. The Rockefeller Foundation is doing some tremendous messaging and programming around testing, tracing, quarantine. But when you're in the situation room, to be able to have everybody understanding, and you're right, the DoD oftentimes gets USAID better than, dare I say, the State Department. Both very mission oriented, and they sometimes talk the same language.
That's right.
The CDC element, I find exactly right. The last thing I tried to do when I was at USUN is I had a delegation of ambassadors ready to go to Atlanta to see the CDC, not during a crisis, so that they'd have an understanding of what CDC's capabilities were, where the possibilities of cooperation were. But in the end, we had a date. We had January 11th, 2017. We were all set to go. For whatever reason, we even had ways to pay for it. But we had one political in CDC. There's only one, and that's the head of the agency.
That's right.
And for whatever reason, he decided the clock was running down. His mind was elsewhere, and he didn't see the usefulness of it. And so we had to pull it down. But I think those kinds of muscle memory are really critical. Particularly, imagine if we had the kind of international cooperation we need for this kind of crisis that we're not seeing at the UN, and we're not seeing, people are struggling on this. Other kinds of critical lessons, interagency is definitely one that runs through all of these conversations.
I'm sure it does. Another one to me that was striking was the importance of cultural understanding for the communities that you're working with. And that might seem self-evident, but in a crisis, people are in a hurry, and they're not always thinking about how the assistance that we're bringing is going to be viewed and received by the communities where we're working. And I can give you two specific examples from the Ebola crisis. They've been written about, so people may be familiar with them. But with Ebola, it's extremely important that people who have died from the disease, that their remains are handled in a safe manner, because that's one of the main ways of transmission of the disease is through people handling the remains in a way that's not safe. And so we had early on sent burial teams to West Africa to help with that process, and they were using black body bags because that's what the U.S. government provides. And we were not sensitive to the fact that in burial customs in West Africa, white shrouds are normally used. And so the black body bags were very off-putting to communities. And in fact, some communities tried to hide deceased people who had died of the disease because they didn't want them put in these black body bags. And so once we realized that that was a mistake, it was a fairly easy thing to do to switch to white body bags. But it just shows, I think, the importance of being culturally sensitive to the community that you're working with. Another example is that once we created the Ebola treatment units, these were sort of field hospitals or field clinics scattered around West Africa for treating people with Ebola. They were at first very closed off. They had plastic sheeting around them so you couldn't see into them. And there was a feeling in many of these communities that they were a place where Westerners took sick people to die. And they were sort of shrouded in mystery. And so we realized that the communities would be more comfortable if they could see what was going on in these Ebola treatment units. So we began building them with fences, that you could see through, and actually making some of the tents where patients were being treated had clear plastic or windows in them so that people could see what was going on. And it just made communities a little more comfortable with what was happening. And again, that was something that we didn't think of when we first went in, and we had to learn it, as we were going. So I would say, especially in a health-related crisis where you're going to be working in foreign countries, it's essential to have an understanding of the communities and the expectations of the community, or at best you won't be effective, and at worst the communities will actually resist you.
I think, Wade, these are issues that, this is best-in-class development work, whether it's in Pittsburgh or Panama or Peru. Basically human-centered design where you're listening and responding to the local population. I was in New York where we held the refugee summit in 2016. And I think a lot of us came to believe that in part we had a refugee crisis, that these were a lot of Syrians fleeing through Turkey going to Europe. And again, our colleagues in OFTA, they didn't have any education experts in their team. So they're responding gallantly on the ground to the needs of the refugees, but the refugees want to have education for their children. They want something beyond water, hygiene, wash. They wanted to be able to, they need employment, they need education. And so understanding what the needs are of whatever client you have is basic. So those are two great examples of the importance of having it be locally grounded and understanding the messaging, the communication that you're having.
Right.
So interagency, local capacity, local connection with culture, those are two big ones. Any other things come to mind?
The only other one that I wanted to mention, and I don't think we did a great job with it, and I think probably the world is, just because we're 6 years on and we have more capacity, was the importance of data and analyzing what's really happening on the ground. And I know how frustrated we were because it was hard to get reliable data about the number of cases and the number of mortalities, and so I felt sometimes that we were flying blind a little bit just because the data wasn't available, or it wasn't available real time. And I think you're seeing that in spades now on the COVID-19 crisis, and it's many of us have come in the last decade to understand the importance of big data and data analytics, and why policies and approaches should be driven by data. So I just I remember at the time we felt a little stymied by our lack of detailed data, and even though now I think the world as a whole does have better capabilities around managing data now than we did even then. But I still, when I look on the news about the current crisis and the lack of testing, and so you're not really sure what the extent of the disease is. I hope we'll be able to talk a little bit about Africa and COVID, but I think one of the key concerns for me for Africa right now is the lack of testing. And so people are saying that the disease is not making inroads into Africa, which I hope is true and may be true, but I'm not sure we really know.
Well, this question of data analytics, data, of course, this is the sweet spot for Carnegie Mellon University in general, for Heinz in particular, and we should think about whether there are ways. Obviously, we have a good relationship with Deloitte, lots of contacts, lots of alums, but also with USAID of being able to strengthen that relationship and provide some expertise. We do have alums who are working and people who are graduating, but I understand the role of data being critical versus rumor, and these become life-threatening issues ultimately. And I can imagine also the kind of top-level pressure you would have had from agency leadership, let alone the White House, on wanting to have good data. And we will turn to Africa in a second. I want to touch on two other sort of critical lessons that have emerged from other cases. One is the fog of disaster response. I mean, Susan's talked about it's like the fog of war, and you talked a little bit about it. You're going to work every day and you're not exactly sure what ought to happen. I have to say that as a political appointee, looking at generally the career folks, the professionals, I think that happens a lot, but people are very good at hiding it,
Like, fake it till you make it. Right?
Exactly. So the fog of disaster response, but also
I think that's right.
The role of logistics, that a lot of this, and in part this is related to data, that these are huge information systems challenges, in addition to coordinating cultures of agencies. So any thoughts there are welcome.
Well, yeah. So on the fog of sorry, my computer's telling me things. The fog of war. I think that really is true. And one of the big issues that we had was obviously in West Africa, there's not enough health care expertise to respond to a crisis like that. So there were doctors and nurses from around the world who were willing to go to West Africa, but there was a very real policy question about what if they got sick, and would we evacuate them back to the United States, and what if they weren't American citizens? Would we bring them back anyway because they had been helping, and how would we bring them back in a way that was safe for the people that were transporting them? So there are all kinds of logistical and sort of policy implementation questions that none of it never occurred to me that there are special airplanes with hermetically sealed chambers in them for transporting contagious patients, and that we would need to get our hands on some of those so that we could bring back doctors and nurses who were sick. So there are many kind of logistical aspects of a response like this that you don't even know that you need to know at the outset.
So let's now turn actually a little bit to the current situation, the role of the WHO, the role of coordination. What's your response to sort of the role they played at the time, and where you're thinking they are now?
So they have been, the WHO was fairly roundly criticized back in 2014 for their handling of the response. as I mentioned, I think USAID set up its crisis response unit that I was the head of in March, and WHO didn't declare a public health emergency until August, I think. So they were, in the view of many, very slow to recognize the severity of the crisis, and we felt should have played a coordinating role in country that they didn't do very well. So there was a good bit of, I think, well-deserved criticism of WHO. And what I'm struck by in this crisis is, of course, WHO has its faults, and it's a multinational organization with all the bureaucracy and issues that you find in those sorts of organizations, and you know better than I do, Sarah, because of your work history. But in my observation, they're doing better now than they did in 2014. So they did learn lessons from their response in 2014. They took the criticism seriously, and they have improved their response capability. So I actually don't believe that they are doing a terrible job right now. And I also think, they say you have to fight a war with the army you have, not the army you wish you had. So WHO is who we have, and they're doing better than they were. And I think we need to be in a position to continue to work with them.
Right. Just staying on this issue of coordination, and I'm going to there's a question that's been asked. I'm going to translate it a little bit.
Okay.
The issue of, so I just got off a call where our colleague Tony Pippo was engaging the city of Milan and the city of LA, people that he's engaged who work for the mayor's offices around the Sustainable Development Goals, but who are now obviously in the midst of the COVID crisis. And he was asking, in part because a couple of us had sent the question in, what's the relevance of the SDGs right now? And their response was, this should be the North Star. This is the way that we build back better. This is the way that we can coordinate and collaborate. If there was a value add before this crisis happened, where we had a common framework and a common language, and it gets to the question that our colleague has asked about the need for relationships and pre-existing protocols. And I guess in part the role that the SDGs can play in that. It provides this framework of a common set of questions. Any thoughts that you have on that? Welcome.
Yeah, I agree with that. I mean, just like I was mentioning that the U.S. government needs internal pre-existing protocols to respond, the international community is no different. And I think the coordinating role that the WHO and UNDP are supposed to play in developing countries probably should be better defined and better adhered to by all the international players. So I do think that's important, and I also think it's true. Somebody said that you should take advantage of a crisis to try to come out the other side better. And I do think, I feel like even in the United States, and certainly I think some countries like in Africa probably have not seen the peak yet. So people are going to be very preoccupied in the coming weeks and months with the immediate response and recovery kinds of actions. But people should also be thinking about what is the longer term post-COVID world going to look like, and can we take advantage of the opportunities that it's presenting to try to figure out how to accelerate our progress toward reaching the SDGs. So yeah, I would agree with that.
So let's talk a little bit about how we see this possibly unfolding in Africa across this continent, and it's very diverse. I think we've both been on calls where we've heard a range of opinions from, there's actually some expertise or some muscle memory in terms of community health and tracing, to the idea that the older population is much smaller in many countries, so that's maybe less of a threat. On the other hand, I'm sure we've both been to Kibera or Dadaab. There are populations that it's impossible to do social distancing.
Right.
And place on top of that the issues of supply chains and food insecurity, recognizing, and I think there's an op-ed in the New York Times today, we don't know how this is going to play out. I mean, that's the truth. We don't know. So your thoughts on that?
Well, I mean, I think you've hit some of the points that I would have made. I have lived in and worked in Africa for, you know, most of my life, and I do worry about this pandemic and the impact that it's going to have on the continent. And I, you know, some people are saying, as you said, that because the population is younger generally, that people will be better protected because of their youth. And some people have even said that the warm climate in Africa may inhibit the spread of the disease, which I think would be great. So there are some reasons, I guess, to be hopeful, but there are also big worries, and one of them, as you mentioned, is the inability in some places to implement social distancing measures. There is, generally speaking, weaker health capacity in many of these countries. And then, as I was saying earlier on, I really worry about the lack of testing and the therefore inaccurate data that will come from some of these countries, and I think it'll make the response from the international community and from the local actors more difficult if they don't know exactly what's happening on the ground. So my heart wants to side with those who are hopeful about Africa and this pandemic, but my head leaves me kind of worried about where things are going to go, and I think we have worse weeks and months are ahead of us, unfortunately.
Yeah, I mean, I think people are anticipating that the UN General Assembly is going to end up being remote, or at least the high-level week will be remote, because the expectation is the wave is really going to hit the global south through September, and so that how could you hold an UNGA if you couldn't have all these people? Do you think there's going to be something that we might think of as an Ebola effect, that some countries that have experienced, I mean, I recognize that Ebola is in a lot of different places that are in very different levels of conflict, but for, let's say, West Africa, that certain countries, because they've been through Ebola, they might be in a better position to handle this?
I think so. I wouldn't I wouldn't carry that to an extreme, but I do think in Guinea and Sierra Leone and Liberia in particular, where which were the the focus for the Ebola outbreak in 2014, I do think that those countries and governments understand more than they did about the needs for lab capacity to test for the disease, and then the importance of contact tracing and for communities to isolate folks who are sick. So I do think there's probably an Ebola effect, to the extent that even though the diseases are different and they are transmitted in different ways, that people understand more than they would have about how to protect themselves and protect their families and their communities. But you're still faced in those countries with weak health systems, and I don't think that will entirely mitigate the problem, but it will help, I think. When you look at a country like Congo, which has had sort of an ongoing Ebola problem, and added on top of that political and instability and armed conflict in parts of the country, I think that just compounds the problems, obviously, in containing a disease like this.
Right. I mean, I think everybody's feeling like the only option for places that have that kind of really poor governance or no governance at all and conflict is, I realize it sounds Pollyannish, but it's what the Secretary General has called for, is a ceasefire. I mean, that the combination of conflict and COVID-19 will be just completely devastating.
That's right, and it's not unprecedented. There have been ceasefires for polio vaccination days, and so I don't, it does sound a little Pollyanna-ish on the one hand, but it's not unprecedented, and I think the world would be well served if people could take that to heart.
Well, the only thing that is positive coming out of any of this is the possibility of reimagining what communities are like, and
Right.
then really working very hard to make that reimagining real. And that is, the concept of the building back better. We're coming down to our final minutes.
Okay.
Is there anything you want to add about COVID-19 and the response? The kinds of things that you're thinking about working on currently, and we should have said at the top that you're here in your personal capacity.
Yes. Yeah, thanks for that. Yeah, as you mentioned in the intro, I work on international development issues at Deloitte, but I am speaking in my capacity and not on behalf of Deloitte. But I will say that Deloitte has an international workforce, and we are very interested in helping to respond in countries around the world. And we are having a number of governments turn to us for advice on both the immediate response, but also like how is this going to look when we're beyond it, and are there ways that people can work better and smarter in the future with some of the lessons that we're learning now.
We'd love to help you think through that. So,
well, we're open to all good ideas. So maybe you and I should talk after the call.
Sure. How have you guys? I mean, you guys went to virtual. You went to virtual pretty quickly.
Yes, we.
Gotcha. And I'll let her know.
Sorry, we've got somebody who's.
Terrific. Talk to you then.
Not on mute.
Okay.
Go ahead.
Yeah, so Deloitte is actually very set up for people to work virtually anyway. Everybody has got a laptop. I have Sarah, you'll appreciate this. When I went from USAID, which is not the most technologically advanced agency in the world, to Deloitte, I felt like I had just fallen off the cabbage cart. I was so amazed at the technology and how the network always works and everything I felt like I was in a technological heaven. But everybody has a laptop. Everybody works from home routinely anyway. So when we went to a virtual work status, it really didn't change it in a lot of ways. I think the inability to travel has made us have to search for new ways to work with our clients and overseas. But I think some of those lessons will stand us in good stead. And we've actually I have personally seen that sometimes you can do something over a video that you would in the past have traveled for. And maybe, it's better for all of us if we don't travel quite so much.
Definitely. It's certainly better for
environment.
Our planet, right?
Yes, right.
I mean, I think the bar for when it is essential to travel is going to change.
I think so too.
And I think a lot of us have thought that should probably happen anyway, and so now we have the reason to do that. Well, we at Heinz are very interested in growing public interest technologists that work in government, that work in the private sector, that work in nonprofits. We recognize that there is that gap, that whether you're on the Hill or at AID or at the State Department or other parts of the US government, your infrastructure tends to be not up to date.
Right.
And the skills that are required are not always at hand. And we very much want to grow the pipeline so that our students who are skilled in 21st century technologies and data can help manage these crises as they go
That's right.
forward.
I've been sort of amazed, that the internet hasn't broken, given the stresses that are placed on it by the world right now. But and I have to say, because I don't want to
jinx it,
criticize USAID too much, but USAID has done quite well in terms of teleworking, and their infrastructure and network has withstood the stresses too. So that's great.
Good to hear. Wade, thank you so much for joining us. And
thanks for inviting me.
We look forward to continuing the conversation. Thanks everybody so much for being with us. Bye now.
Thanks, Sarah.